As a health and social care professional, continuing professional development, or CPD, is the way you can maintain and improve your knowledge, skills and competence through various types of learning. And it's not only formal learning like courses and modules, it is in fact any form of learning that contributes to your professional practice. As part of your own Code of Professional Conduct and Ethics, keep in mind that you are expected to achieve 30 credits of new or enhanced learning in every 12-month period. You might think that 30 credits sounds like a lot, but you're probably already doing most of that as it is. And that's because there are lots of tasks, practices, or activities that can be counted towards your 30 credits of CPD. These include supervising a student on placement or participating in supervision, reading professional publications or other relevant material, reflecting on an interaction with a service user or a particular case, learning about new technologies, reviewing policies or procedures. As you can imagine, there are so many examples, and it's almost impossible to list them all here. Remember that here at Carew, our CPD system is very flexible and it recognises lots of different types of learning. And if you can't see an activity you have completed on this list, do not worry. The list here is by no means exhaustive or complete, and it is more about suggesting some examples. So just because you didn't see your activity just there, that does not mean you cannot count it as CPD. No two jobs are the same, and our approach takes into account the different needs of people in all health and social care professions at different stages in their career. The main thing to remember is that you can choose what learning activities are right for you. And if it results in new or enhanced learning for you, then it qualifies as CPD learning in our eyes. Let's take a closer look at two different types of learning that can be recorded as CPD. 1. Planned learning is any activity you undertake where you expect to develop knowledge or skills before you begin. That includes anything like going to a conference, taking a course, or a formal meeting to discuss something with colleagues, for example. 2. Unplanned learning happens when you learn something or gain a greater understanding of an issue without any prior thought or planning. This might include watching a relevant TV show, doing internet research, or even chatting with a colleague over a coffee. When you think about it, you have almost certainly benefited from both planned and unplanned learning many times through day-to-day activities. Keep in mind that when we talk about a learning activity, we mean any activity that contributes to the development of your knowledge, skills and competencies as a health and social care worker. And each and every one of these can be considered CPD. Just remember that the learning must be relevant to the needs of your service users or your employer, or both, and can be applied or will contribute to your practice. Ask yourself, can you apply what you have learned to change or improve how you work on a daily basis? Have you learned something new that confirms you're already taking the best approach in a given task or situation? And finally, how has any learning, planned or unplanned, helped you provide a better service to clients and patients? It's a good idea to reflect on these points so that you can show how learning has helped you in your work and career over that all-important 12-month period. And one last thing, as a health and social care professional, it is your responsibility to keep a full record of your own CPD. When it comes to all things CPD, if you have any queries, we'd be happy to help. Our comprehensive frequently asked questions section on carew.ie will probably answer any questions you might have. If you can't quite find what you're looking for there, feel free to send us an email to cpd@carew.ie.